In a moment, we're going to come to this concerning story. UNICEF State of the World's Children 2023 report makes for concerning reading. Among the revelations is the fact that almost 13 million children are under-vaccinated in Africa. These are children that have missed out on one or more vaccinations over 3 years. It also finds that vaccine coverage is going down in over 100 countries. The For Every Child report names this as the largest sustained backslide in 30 years. UNICEF's Eastern and Southern Africa Regional Health Advisor, Dr. Paul Ngwakum, joins us now. Good evening to you and welcome. Well, let's start with this. 8.7 million of that 12.7 million hasn't been vaccinated at all, and they are referred to as zero-dose children. What are some of the reasons why that's the case?
Zero-dose children basically is because of the acute situation that happened during the COVID-19 pandemic, where there was kind of lockdowns that resisted, that stopped people from having access to vaccination services. But before the COVID-19 came, there has been a problem of stagnation of vaccination. In Eastern and Southern Africa, for example, we had a stagnation of 79% of coverage for DPT3 from 2012 to 2019, before the big drop of 5% to 74% in 2021. The causes are many, and most of them are linked to systemic, outside the pandemic, as systemic issues linked to weak health systems, including governments not taking forward primary health care, 2, lack of human resources in number and distribution, and above all, lack of financing.
I mean, these are serious reasons, and you talk about the pandemic making access worse, but also there's a pre-existing non-vaccination culture that's set in a way. Nigeria and Ethiopia, the top 2 zero-dose countries, what are some of the peculiarities about why that is for these two countries?
I think the peculiarity is that they have the same issues linked to systems. In terms of access, we have issues linked to hesitancy, which may not be the same causes in Nigeria as in Ethiopia, but we have to be able to talk to the communities to understand the underlying causes of why we have vaccine objectors. But on the supply side, as I said before, in both countries, we have to take to scale primary health care. We have to ensure that we provide the resources, especially the financial resources, to procure the vaccines and ensure that we have the operational costs to be able to reach the hard-to-reach children. But in addition to this, in both Nigeria and in Ethiopia, you may understand or you may know there are issues linked to insecurity in some parts of these countries, making access a bit more difficult for the children.
Yeah. You know, when you put it in these terms, Dr. Ngwakum, it really brings to reality what the impact of instability is on the most vulnerable of our populations, and these are children. When we think about what diseases these children are now vulnerable to, just run us through that list.
Well, I think vaccination, I cannot come out to list a list of all the vaccines that children are vaccinated against, but you may know one of the high causes of under 5 mortality is measles. And measles is a vaccine-preventable disease. And actually in Eastern and Southern Africa, because of the accumulated number of unvaccinated children, we are having multiple measles outbreaks in many countries.
Yeah, I mean, you also have things, things like cholera, I suppose, polio as well on the African continent. I want to go to a really important question, which I suppose fulfills health awareness or a public service mandate around what can populations, what can parents, what can communities do about this now? Can you make up for missed vaccinations?
Yes, I think the actions are on both sides. The actions are on the population side. The actions are on the supplier side. what we call the duty bearers or governments. We have to have supply before there is demand, and when there is supply, there has to be demand. So, number one, as I said, governments have to invest in primary healthcare. And when you invest in primary healthcare, it means you put money on the table to be able to finance this primary healthcare. As you may know, in most of Africa, most countries, they are still trailing behind the different declarations. Like we said in Abuja, government should put 15% of their resources on healthcare delivery. Many countries are not putting up to 10%. In addition to that, there has to be governance structures to be able to ensure that there are efficiencies, operational and allocative efficiencies.
Yeah.
Making sure that these resources are put to be able to procure, for example, vaccines. But on the population side, as you rightly said, they have to demand for these vaccines, but there are some barriers which are maybe religious beliefs or socio-cultural beliefs that we have to work to, but these are context-specific issues that we have to understand the main drivers to be able to talk through with the populations.
Yeah. Well, just to take that concept one step further, if a child has missed their vaccination, can they make up for it? Can you vaccinate them even after the optimal period when they should have been vaccinated?
Yes, in our catch-up plan, even children that have missed vaccinations up to age of 5 years, they are eligible to be vaccinated.
Well, thank you so much for talking to us and for just sharing the dire consequence of under-vaccination and no vaccination at all on the continent. You would have heard the WHO's Tedros Ghebreyesus a little bit earlier on speaking in that Cape Town conference about some of the perceptions that are causing, vaccine resistance in the world and really trying to counter that. We appreciate your time, Dr. Paul Ngwakum, UNICEF's Eastern and Southern Africa Regional Health Advisor. And speaking of that story, the DG of the WHO, Dr. Tedros Ghebreyesus, has called on warring factions in Sudan to stop fighting and to allow medical personnel to go in and assist the injured. More than 400 people have died in the conflict between government and paramilitary forces. Dr. Ghebreyesus was at the University of Pretoria, where he received an honorary doctorate in recognition of his work as a global health expert, scholar, advocate, and diplomat.